Good day to everyone. I am Joseph Ryan Marcelino, a graduate of Bachelor of Arts in Political Science at Northwestern University, a former president of the Red Cross Youth Council Ilocos Norte chapter, and an RCY instructor. And currently, I'm the SK chairman of our barangay, and I am a professional education student at Northern Christian College of Lowag. So I will act as a counselor for today. And I have here also my sister-in-law, Miss Maridel Viloria, a teacher at Basic Education School at Northern Christian College, and who will act as a counselee for today. So the COVID-19 pandemic has likely brought many changes to how you live your life, and with its uncertainty, altered daily routines, financial pressures, and social isolation. You may worry about getting sick, how long the pandemic will last, whether you'll lose your job, and what the future will bring. Information overload, rumors, and misinformation can make your life feel out of control and make it unclear what to do. During the COVID-19 pandemic, you may experience stress, anxiety, fear, sadness, and loneliness, and mental health disorders, including anxiety, depression, and can worsen. So our topic for today is all about mental health issues due to the pandemic COVID-19. So, this is also a big shout out to everyone to step up, innovate, and cope up with the changing times. Counseling is possible even if, especially that there's a COVID-19 pandemic as of today. So we'll start. Miss Maridel Viloria will be the counselee for today, or the patient, and I will be the counselor or the provider for today's counseling session. Hi Maridel, good day. How are you?
Great, thanks. Nice to meet you.
Nice to meet you too. Well, I'm Ryan. Welcome to the service. How did you know about our service?
Well, I'm talking to a friend, and she said about the service that is excellent and really of a great help to everyone.
Great, thanks for coming. And I just want to start that our service is a counseling service for women. Therefore, you are fit to this category, which is really good. Now, I just want you to let you know that this is your first and initial interview, I guess. So today I'll be hearing some of your story, and we will work through over a process, and I'm sure we'll get an opportunity to meet again. Is that okay?
That sounds good. Thank you.
So excellent. So Maridel, in our website or our page, I believe you have gone through it already.
Yes, I have read all the information already.
So we have posted in our page the way and how we keep your privacy and confidentiality. And I just want to clarify this before we go through our session. So within the community center here, everything you say to me today will be kept in a confidential environment. However, if there are circumstances that you are at risk, or people at risk, or you will be having an illegal activity, I will report it to proper authorities in order for you to get some help or assistance in dealing with that particular situation. Is that okay?
Yes, that's fine. It's okay.
So Maridel, let's start by telling to me what brought you here today.
Well, I had just been feeling very anxious.
So when did it all start?
I started feeling worse a few days ago, but last night it got really bad.
So what happened last night?
The thing is that all night long, I was feeling nervous and jittery. I just couldn't relax. My husband was really worried. I tried to go to bed and fall asleep, but I couldn't. Then all of a sudden, I felt short of breath. I was gasping for air as if I were drowning.
Did you have any other physical symptoms like pain?
Yeah, I had a terrible headache back here in my nape of my neck.
So you said, Miss Maridel, that you had been feeling bad for several days. What had you been feeling?
At work, I couldn't concentrate at all. It was irritable with everyone. My nerves were shot. Every little thing would startle me. I didn't have any appetite. Whenever I would want to eat, it would make me nauseous. But the worst thing is that I couldn't sleep at all. I think it's been like 4 nights now that I have hardly got any sleep.
So you said that you're emotionally unstable for several days now. What do you think are the reasons why you're feeling all this way?
Maybe it's all because of what is happening right now in our society. A lot of things have changed. It seems like everything is being controlled, and I felt like every action I make should be calculated because one wrong move, I'll face a big consequence.
So like what are those actions that you might do?
Now that there is a COVID-19 pandemic, we are obliged to use face shield and face mask for our protection.
Mhm.
And once that you may forgot to use those protective equipment in public places, you will be penalized by the government.
So in connection with not using of protective equipment, like face shields or face mask, what are the penalties that you may encounter?
You can be penalized up until 5,000 pesos, or the worst thing is that you will be put in jail.
Oh, I see. So what are the other reasons that made you emotionally unstable for the past few days?
I am afraid to be infected with the COVID-19 virus, but I've seen the current situation in India that hundreds of thousands have died already because of the said virus. I don't like to die yet. Even if you have vaccine already that is available, I am afraid to be vaccinated for some reasons.
So what are your reservations why you don't like to be vaccinated?
There are some reports out in the television and over the radios that there were people dying because of COVID vaccines.
Oh, now I see. So from your chart that you've sent me or you've given me, that you had been seen by a psychiatrist for anxiety in the past. So were you ever prescribed any medications for anxiety or depression?
Yeah, he gave me 2 pills. One was for depression, and I think it was called Zoloft.
So, and the other one?
It was a little round one that was called Laraza
Lorazepam.
something.
Lorazepam.
Yeah, that's it.
So did they seem to help?
A little bit. The Lorazepam one, the doctor took away. The doctor, the other one, I just stopped talking.
So, lorazepam is usually just taken short term because it can cause dependency. So what about the antidepressant? Why did you stop taking that one?
The thing is that I took it for several days and it really didn't seem like it was helping much. I just made me feel tired and numb all the time. I don't know how to describe it. It was hard to concentrate at work. I was scared that I was going to get fired and I really can't afford to lose my job. So I just decided not to take it anymore.
So well, antidepressants can take several weeks to have an effect. So you really need to stick with it. I think it would be good for you to follow up with your psychiatrist again. There are many kinds of antidepressants out there. Maybe you can try a different one to see if it helps you better. So the thing is, though, that sometimes when people start taking medicine for depression, at the beginning they can feel worse, even suicidal. So, for which reason you'll need to stay in touch with the doctor and not miss your follow-up appointments.
Okay, but the problem is that because I missed a few appointments, supposedly that psychiatrist doesn't want to see me anymore.
So if you give me a couple of minutes, I can make some calls and see if you can be seen again in that clinic. At this point, Miss Maida, the most important thing for you is to Get regular outpatient care to get your anxiety under control. Give me a few minutes to make some calls and I'll come back and let you know what I find. Sound good? Sige. So, I called them and they're not able to see you again at that clinic. We have a clinic associated with our center. I will make you an appointment at that clinic if it's that okay with you. We use interpreters at the clinic too, alright?
That should be okay. I will try to do better. And this time, get into my appointments. And thanks for everything.
Thank you very much, Miss Maridel.
Thank you very
Thank you
much.
for coming into our service. So that's the wrap up of our counseling session with Miss Maridel. So again, thank you very much for watching.